and therefore that also helps our patients' outcome as well.
Absolutely.
Now, I want to talk about the nutritional deficiencies and kind of like overall explaining to those who are going through the process, what are the nutritional deficiency and is it like long-term and what can they do to address those concerns ahead of time?
Absolutely. So essentially, one of the ways in which bariatric surgery works is by decreasing the amount of food the patient consumes, right? Because that will lead to a direct decrease in the caloric intake as well, right? But when we are interfering with the patient's ability not only to eat food, but also to process that food by making changes in the digestive tract, yes, we are succeeding in decreasing their caloric intake, but we may be interfering with the patient's ability to take in absolutely necessary nutrients, the so-called micronutrients. And these are clearly vitamins and minerals. Now, this is much more pronounced with procedures where there is intestinal diversion or intestinal bypass, like the gastric bypass or the duodenal switch. It is less significant, less impactful rather, with a procedure like the sleeve gastrectomy, where there is only interference with the stomach and not with the intestine, and of course, even less so with the lap band. So what we have to do is we have to educate our patients about this fact that will become a reality in their post-surgical life, right? And we also educate them of ways to minimize its occurrence or avoidance of this problem totally, right? And this is based on getting them to do two things. One is to make sure that they have multivitamins and minerals appropriately on top of what they're eating. So all our patients will have multivitamins, but some patients may even need additional specific vitamins, like for instance, vitamin B12 or folate or vitamin D, particularly patients who've had intestinal bypass surgery. The second thing we want them to understand is that they need to follow up with us or their primary care with respect to checking for these deficiencies, which means they have to have blood tests done periodically. It doesn't have to be every month, but in the long term, they should have blood tests done at least once a year, if not twice a year, and then address deficiencies that are reported on that blood work.